The event was started with Rwandan traditional performance by the National Dance Troupe as well as Nyundo School of Music and Arts students. As he officially opened the 20th International Conference on AIDS and STIs in Africa, President Paul Kagame stated that AIDS knew no borders and all countries needed to join efforts in tackling the viral infection.
AIDS is an epidemic without borders. Much of the success in the campaign to halt the spread of the virus can be credited to global cooperation. It is therefore vital to continue raising the level of support for initiatives such as the Global Fund, Gavi, and PEPFAR, which have made such significant contributions. Governments in Africa, for their part, must prioritize domestic financing for healthcare. Doing so creates a sustainable, long-term foundation for these valuable partnerships.
This was emphasized by the Director General of World Health Organization, Dr. Tedros Adhanom Ghebreyesus, who mentioned that political will was important in meeting the Sustainable Development Goal of good health by uprooting new HIV infections. He said Rwanda and his country Ethiopia had made great strides in mitigating HIV infections on the continent.
I know from my own experience that support from the highest levels of government is essential for making real progress. That's what enabled us to make progress in Ethiopia. And that's one of the key lessons here in Rwanda. The results you have achieved would not have been possible without Your Excellency's vision and leadership, not only for HIV, but for universal health coverage. Your Excellency, President Kagame, please accept my respect and appreciation for your strong commitment and leadership, not only to HIV, but to universal health coverage.
This conference was also attended by Mozambique President, His Excellency Filipe Nyusi, who stated that the gathering was a great platform to set firm strategies in fighting HIV/AIDS, given that his nation has high HIV prevalence.
Mozambique
is one of the most affected countries by HIV and AIDS in sub-Saharan. In addition to drawing experience, we have come to Kigali to reaffirm the determination of our government to combat HIV and AIDS pandemic and the proliferation of infectious diseases until the eradication.
President Kagame elaborated that fighting HIV/AIDS needed to start among citizens at the grassroots level, give them adequate information and medical facilities, pointing that the right leadership prioritizes citizens' health.
Good politics and governance have everything to do with health. There is no substitute for building an inclusive, caring society. Citizens, both young and old, must see themselves as stakeholders with a future to look forward to. Health is about making good choices right now for benefits that may only be felt years later. In other words, this fight against HIV and AIDS and build the resilience required to handle other challenges down the line.
The 20th International Conference on AIDS and STIs in Africa convenes as 68%, which is 38 million citizens of the African continent, are suffering from HIV/AIDS.